one other quick announcement. The week of Earth Week, there's some people in the community that are trying to buy a bunch of trees to take out to elementary schools, and we might need some volunteers to go into the schools and tell the kids about how to plant and stuff like that. So I think it'd be great if like Women in STEM wanted to take a group of students, or environmental club, or the baseball team, or kind of have these little crews that would go out and then, well, maybe we shouldn't trust them with elementary kids. But anyways, yeah.
When is that?
It's the week of April 18th, I think, right after Dogwood weekend. So I don't know what day specifically and what the details are, but if you're interested, please let me know, because we are looking for small groups to kind of go through these topics. So I'm really happy to get to introduce Leslie for her science seminar presentation. I know Leslie's anxious and ready to kind of get this over with, but I think she picked a great topic. It's very interesting, very uncomfortable. You guys are all going to squirm a little bit as she talks about it. It's one of the things I like about seminar is I get exposed to topics that I know nothing about, right? So when I get to help students with these things, I'm learning a lot about it. I'm really proud of what Leslie has been able to do. She's put a lot of work into this. If you guys don't know, Leslie's been here for about 3 years now. She went to Walter State Community College for 2 years before she came here. Was really interested in agriculture courses there at Walter State. And then coming here to biology, she's taken what we have to offer here and kind of made it her own and done her own thing with it. A lot of advice from others in the department, and really proud of her. She works at Kingsway Charities. She volunteers there. She works with Small Miracles Equestrian Therapy Center. Is that how you say it? And I'm curious about the Small Miracle. Is it specializing in small horses, or?
No, most of them are big, but they do have a few small ones.
Okay. Really interested to see what she has to talk about tonight. So, anyways, if you guys will give her applause as she comes up.
Thank you, Professor Rudd, for that wonderful introduction. My name is Leslie, and my topic is improving healing response and beef production via different castration methods and analgesics in Angus crossbred calves. So like he said, I went to Walter State, which I did a lot of agricultural courses there. But before that, I went to UT Martin for Governor's School in Agricultural Sciences. And it was a really neat experience because I got to perform cattle castrations, cattle palpations, horse care, and other large animal experiences there. So then I went to Walter State, and I also got to do cattle castrations, vaccinations, etc. So when I came to King again, there wasn't any agricultural courses, but there was biology, and I heard the biology department was phenomenal, so that's what I went with. Even though we don't have agricultural courses here, we have a lot of courses that interact with agriculture. So I've taken what I've learned in the past and then what I've learned from my classes here, and I've kind of went with this project, so I'm excited to share it with you guys. Cattle is really important to the U.S. because beef is a major industry. I personally eat a lot of beef, and I'm sure a lot of you guys do too. We actually import a lot more beef than we export, and that's just because, again, we do eat a lot of beef. If you take cattle to feedlot, though, they prefer steers to bulls, and feedlot is just like you would take them to slaughter. And I'll get into why in a little bit. So first off, Austin, which one's a bull and which one's a steer?
The left is a bull.
And why do you think that?
Just a gut feeling.
Okay, yeah. The left one is a bull, but I'm going to get more into why that is after I define them. So a bull or a sire would be a mature male bovine that's older than 2 years old. And then a steer would be a castrated male bovine, and bovine is interchangeable with cattle here. And then another word I'll be using is calf, which is a baby male or female. So sometimes I may say a bull calf, and that's just a young male. So back to this picture. First off, there's some primary sex characteristics here. So if the one is here, this one has a scrotum. Versus here, you can't really tell. But even if it did or didn't, you can tell by the secondary sex characteristics. So if you look up here on the neck, this one has a very flat neck, and the bull is very rounded and humped. So that's one area. And then if you notice from the front of the bull to the hindquarters, it's very muscular. And the steer is very lean. You don't see much muscling at all. Again, those are the secondary sex characteristics. Why do farmers even castrate bulls to begin with? So castrating stops testosterone and sperm production. If you stop testosterone production, it'll make the animal less aggressive and makes it a lot easier to manage. It also allows better marbling in the meat because you're adding fat earlier on instead of like adding muscle over and over again. And this is why steers again bring more money. It also controls mating by stopping sperm production. So if you have a bull that is terrible, like it's very aggressive, it doesn't put on meat well, and the meat quality just isn't there, you don't want it mating with the cows in your field. To start off with, let's talk about testosterone and sperm production. So they're both produced here in the testes. Testosterone will be produced here, and if you'll notice this red here, it's indicating blood vessels. So the testosterone will be carried out via these blood vessels, and it'll travel to different parts of the body for these secondary sex characteristics, such as aggression and the muscling. Then you'll also have sperm produced in the testes, and the sperm will be matured in the epididymis, and then they'll travel up this spermatic cord to the vas deferens, and then they'll go into this urethra, which the urethra is a connection of, if you see here, the bladder and the reproductive system. And then it'll be ejaculated out of the penis. I mentioned a little bit of the blood supply, so if you look here, this gives you a little bit better of an idea. So you have testicular veins and arteries traveling down to the testicle itself, and then arteries within the testicle. And this is important to keep in mind when castrating because you don't want to just slice a vein or artery open for obvious reasons. First off is surgical castration. So surgical castration is done with a Newbury knife or a scalpel, this and this. So what you'll do is you'll take your Newbury knife, and there'll be a testy here and a testy here. We can put this on so you can see. And what you'll do is you'll clamp it. It's a knife here, and you'll clamp it about right here, and then you're going to pull straight down, and it'll make a nice cut through the scrotal sac. When it makes the cut, the scrotum is like this, and it'll open it up like that, if you guys can see. And this allows better drainage, so there's less likely a chance of infection. After you cut the scrotal sac open, you'll grab one testy at a time, and you'll pull until it gives. And once the testy gives, then you're wanting to push the blood vessels back up along the spermatic cord, and then you'll pull off at the end. And you want to do this so that you are disrupting these blood vessels, so the blood is clotting ahead of time, so when you do pull off, it doesn't bleed out as much. Sorry. Okay, so this is me on Dr. Moyer's farm performing a surgical castration. He actually let me and Kate go out there, and it was really cool. This is also on his farm. So as you'll notice here, this is the testy, and then this would be where the spermatic cord is, and this is where we pulled it off, so where it was detached from the body. You can see blood here, but there's not as much blood as there would be if we hadn't damaged those vessels to begin with. So next up is band castration. So you'll use a bander, similar to this up here. And whenever you're doing band castration, you want to make sure to get both testicles in the bander. Sometimes if they're scared or they're cold, they'll pull their testicles back up in their body. So once you make sure you have both testicles through the bander, you'll place the ring over the spermatic cord. And this again will stop blood vessels. So the testicles will not receive blood and they won't be able to give blood back. And if something in your body isn't receiving blood, it essentially will slough off because all your cells will die. When talking about castration, you also need to talk about tissue repair because it's a big factor in castration. So there's 4 phases: hemostasis, inflammation, proliferation, and tissue remodeling. We touched on hemostasis a little bit. That was the blood clotting in the vessels. Inflammation is a big stage in wound healing. So you have 5 cardinal signs. You have redness, heat, swelling, pain, and sometimes also function. And inflammation actually will tell you how long the healing process will be because it's a major process of wound healing. Then you'll have proliferation where cells are replicating and they're going to the site of infection or injury, and then the tissue will remodel. In human medicine, we use analgesics very readily, and analgesics are just a pain relief without complete loss of feeling or complete loss of consciousness. So So we use them for pretty much anything. If we have a headache, we have surgery, your arm hurts, we use an analgesic, and they're very easy to get again. In cattle, however, analgesics are not readily used. Phenamine transdermal, which the active ingredient is flunixameglumine, is the only FDA-approved analgesic in cattle, and it must be used for foot rot and recommended by a veterinarian. So if you use phenamine transdermal for anything else other than foot rot, or you want to use another analgesic, you have to get it from a veterinarian, and they have to label it extra label drug use because it's not being used for what it's intended to. If you notice right here, this is a bolus device. So if you were to give medication orally, you would stick the tablet up here in that, and then you would stick it to the back of the cattle's throat, and then you would expel the medication down their digestive tract. And then this right here would be a subcutaneous injection. So you're going to pull the skin up, and then you'll stick the needle in and expel the medication under the skin. In Canada, however, they have a beef code of practice that requires that you use analgesics in cattle over 6 months of age. So instead of nothing being approved, you have to use it. It's not an option. And they use meloxicam readily for that, and that's just to reduce pain and inflammation. Remember I said flunixameglumine is the only thing we have FDA approved, and then meloxicam is what they use for cattle castration. So why did I choose meloxicam? A single dose of subcutaneous meloxicam was found to be as effective as 3 IV doses of flunixameglumine when used in respiratory disease. And this was found by Fratton et al. In 2004. And this wasn't castration, but they have similar effects. So I decided to stick with meloxicam. Meloxicam is a non-steroidal anti-inflammatory, and it provides systemic analgesia, which means it works all over the body to reduce inflammation. The purpose of my presentation was to compare the effects of castration method, ban versus surgical, and analgesic use, meloxicam versus none, on healing response and beef production. I hypothesize that castration method and usage of analgesic will have an effect on cattle stress and average daily gain. And then I predict surgical castration with meloxicam will cause the least stress on the animal, resulting in more average daily gain, while ban castration will cause greater stress, and overall meloxicam will reduce those effects. I plan on testing these by measuring serum haptoglobin and cortisol concentrations to look at stress, and then looking at average daily gain to measure beef production. So to start off with, serum haptoglobin is an acute phase protein, so that just means concentrations of them increase with short-term tissue inflammation, and they're activated whenever the infection or the injury is worse than our defense system can recognize or deal with. All in all, increased serum haptoglobin concentrations indicate increased inflammation, which indicates increased stress. Cortisol is a stress hormone, and it affects a lot of our body, but for the purpose of my experiment, I'll be talking about how it reduces inflammation. And all in all, increased cortisol concentrations indicate increased inflammation, which indicate increased stress. And recent studies have actually said that cortisol is more involved with the long-term chronic stress. And if you'll remember, I said serum haptoglobin was more acute or short-term. To measure beef production, I'll be looking at average daily gain, which is just the weight gain over time. So if cattle weighs 500 pounds and it gains 100 in 31 days, it would have an average daily gain of 3.2 pounds per day. For my first paper, I looked at the effect of castration method and analgesia on inflammation, behavior, growth performance, and carcass traits in feedlot cattle by Roberts et al. In 2018. The purpose of their experiment was to test if castration method and use of analgesics would affect behavior, inflammation, growth performance, and carcass traits in feedlot cattle. They looked at all these things in the box, but for the purpose of my experiment, I'll be focusing on average daily gain and serum haptoglobin concentration. They studied 194 cattle that were a little under 300 days old. And then they arrived at feedlot but were allowed a 10-day acclimation period. So they weren't treated until 10 days after they arrived at feedlot, and this was to ensure that the stress that they were under was due to the actual treatment itself rather than the new environment. The ones that were treated with meloxicam were done so at 1 milligram per kilogram of body weight orally. Some were surgically castrated, some were band castrated, and then the blood was collected via the jugular. So here are our groups. We had 194 Angus crosses. 42 steers were put in our control group. In our control group, they were castrated within 48 hours of birth, band castrated. And for our treatment groups, we had surgical with meloxicam, band, and band with meloxicam. And our treatment groups were castrated on day 0, which again was 10 days after arriving to feedlot. For our study one results, the serum hemoglobin concentrations are here, and then the time and days here. If you'll notice the A, B's, and C's, if you go from an A to an A, there's no statistical significant difference. An A to a B within 1 day would indicate that they are statistically different. So if you look on day 4, this would be the surgical group, and this is surgical with meloxicam, and there is a great reduction in serum hemoglobin concentrations. And you'll notice the A to the B, so it is statistically significant. If you look right here, this is band, and then this is band with meloxicam. And it looks like there's a reduction, but again, B to B, so it's not statistically significant enough to say that that's what's causing it. Also, if you'll note, here is surgical again, and here is band. There is a great decrease, A to B, so it is statistically significant. So all in all, this is saying that surgical castration caused elevated levels, while meloxicam reduced those levels, and band castration levels were lower. Looking at average daily gain, this is just a zoomed in portion of this, so focus on this first. It was separated by castration method, so band versus surgical, meloxicam usage versus none, the interaction of the two, and then the control versus the castrate. So those that are castrated within 48 hours versus those that were castrated on day 0. And we see here the only p-value less than 0.05 was with meloxicam, indicating that meloxicam had an effect. And if we go back to here to our actual data for overall average daily gain, surgery to surgery meloxicam added some, and band to meloxicam, band with meloxicam went up as well. So this indicates the meloxicam had a positive effect for average daily gain. So again, summed up my paper 1 findings, serum hemoglobin levels were elevated and surgically castrated. Meloxicam reduced this effect. And then for average daily gain, meloxicam was the only thing indicating it had an effect on average daily gain. My next paper was on the effect of a single dose of subcutaneous meloxicam prior to band or knife castration in 1-week-old beef calves, the inflammatory response and healing by Marty et al. In 2018. The purpose of their experiment was to compare the effects of castration method and the use of meloxicam on inflammation, response, and wound healing. And again, they looked at all of these things, but I'll be focusing in on average daily gain and serum hemoglobin concentrations. And I'll also be looking at cortisol concentrations. It's important to know that their 72 calves were much younger than the last study, so they were 7 to 8 days old. Some were surgically castrated, some were band castrated, and the ones that were administered meloxicam were done so at 0.5 milligrams per kilogram body weight subcutaneous in the neck. Blood was collected via the jugular, and then forehead hair was shaved to look at hair cortisol concentrations. So here's our randomly assigned groups. We had 72 crossbred calves. And we had 2 control groups for this experiment. So we had a control group and a control with meloxicam. In our control group in this experiment, the scrotum was manipulated, so they were put under the same stressors, but the testes remained intact. Then we had, for our experimental groups, we had this surgical with meloxicam, band, and band with meloxicam. And again, those were castrated at 7 to 8 days old. For our study 2 results, first we'll look at serum haptoglobin concentrations. Again, this is the data from over here, just zoomed in. So if you look castration method, surgical versus band, medication, so meloxicam versus none, and then the interaction of the two. Notice there is no p-values for serum haptoglobin, less than 0.05, indicating that there was no significance of these having an effect on serum haptoglobin concentrations. And that's evident if you look up here. So we have control, band, and knife. And then NM is non-medicated and M is medicated. And they are all very similar in numbers. Next we have the hair cortisol concentrations. This is the concentration on this side and then the days post-castration. So we had the day before, 28 days after, and 56 days after. Here they don't indicate significance, the letters don't, they indicate trends. So if you'll notice, they are reduced here, but it's not enough to say that those are the reason. That's actually reasons why. But if you go to 56 days, the band group is still elevated while the others are reduced. So this indicates that banding had higher hair cortisol concentrations 56 days post-castration. Also note that the banding with meloxicam was reduced compared to the banding group. For average daily gain, again, we'll be looking at the p-values that are listed here, zoomed in. So after day 56, the castration method, surgical versus band, medication versus none, and the interaction of the two, there were no p-values less than 0.05. And then if we look back, again we have control group, band group, and knife group, non-medicated and medicated. The average daily gain on day 56, they were all very similar in number within the standard error mean. There was no statistical significance saying average daily gain was affected by castration method or meloxicam usage. Summed up my paper 2 findings, neither castration method or meloxicam affected serum haptoglobin. Band castration had elevated levels of cortisol compared to surgical on day 56, and meloxicam reduced this effect. And then no data supporting anything having factor on average daily gain. So we go back to my hypothesis. I said that castration method and usage of analgesics will have an effect on healing response and beef production, but I cannot really accept this hypothesis. My first study kind of suggested that my hypothesis would be correct, but my study 2 contradicted that. So in study 1, I was looking at castrating older calves, and study 2, castrating younger calves. And my conclusions from study 1 was that surgical castration increased inflammation, and meloxicam decreased inflammation in surgical castration. And then meloxicam overall increased beef production. In study 2, castrating younger calves, neither meloxicam nor castration method affected acute healing or beef production. And band castration was found to affect long-term healing responses indicative by the cortisol levels after day 56. And meloxicam overall improved this effect. So what happened? Why were my findings so different? If you'll notice, the study 1, they were castrated at about 300 days old, whereas study 2, they were about a week old. So this is likely the reason the results were so varied. And the studies could also use greater cattle numbers, especially study number 2. They only had 72 cattle they were looking at. And this is very difficult to do in large animals because of space constraints. It takes a lot of time to look at this, and then money is also an issue. For future studies, I would suggest looking at replicated experiments using larger numbers and more diverse age groups. And actually, the Beef Council of Research in Canada also suggested this. They said there's not enough research on differing ages. I would also suggest looking at the effects of meloxicam versus other analgesics in cattle castration, such as flunixamide. And then I would suggest looking at the cost efficiency for farmers for using meloxicam versus other analgesics such as flunixamide. And to do this, you have to look at how much money you're bringing in with your cattle versus how much money you're spending up front for the analgesics. I would like to acknowledge the UT Martin and Walter State Community College Agricultural Department for giving me a great understanding in cattle castration. the King University Biology Department for teaching me everything else science, Dr. Moyer for allowing me to go to his farm and castrate his calves and use the pictures for my presentation, Professor Rudd for being my presentation advisor and getting me to where I'm at today, and then Dr. Vaughn for helping me interpret my graphs and just being my all-time life advisor. Any questions? Yes.
For your paper two, the cortisol level, why were they so high before the castration?
Okay, so right here, the cortisol levels were a lot higher if you notice the day before and 20 days after. And actually, on newborns, their cortisol levels don't really go down until about 28 days after they're born. So here, they're probably still elevated from that 28 days, and they're probably still going down to normal. And then, obviously, the day before castration, they're very young, so their levels are still heightened.
So with that in mind, with that in mind, is measuring the cortisol during this time period a valid measurement, do you think?
Not for here, I wouldn't say, but I think it is okay to look at because of the 56 days, which is the long-term effect of it.
If you're gonna castrate your cows, why would you not do it when they're young?
Everyone does it differently. The U.S., some people just do it whenever it's more convenient for them, or maybe on the time frame that it is. So if you castrate maybe in the summer, there's more chance of like flies and stuff infecting it surgically. But some people just, there's not a lot of research on it, so some people just do it one way and some do it the other, if that makes sense.
Weight gain's an issue too. They gain better if they're intact.
So if like castration's a painful process and stuff, how do they keep the cows still and not castrated?
I'm gonna go back to a picture for this one. Essentially, you'll use a squeeze chute, first and foremost. So if you have a squeeze chute, you'll put them in it, and it restrains their neck, and then you squeeze their body into it, and that helps a little bit. But then you also have to worry about, kicking. And if you hold the tail straight up, like the picture I'm trying to find, it should be close. Oh, it zoomed in, I'm sorry. Anyways, if you can see the rest of this picture.
I think it was there if you go back one or two more.
It's like your first introduction.
Yeah.
There it is, okay, thank you. If you hold the tail straight up like this, it restricts their motion, likely because their tail is like an extension kind of their spine, so if you hold it up, their spine's kind of restricted so they can't move as well. If that makes sense.
And how many people like does it take to castrate?
I would say at least 2. You could probably do it on your own, but it's getting a little risky.
Why do cows have to have different analgesics than we do?
They have a withdrawal time, so that may be a reason why. Like FDA, we don't approve anything anyways, but if they did, if you use an analgesic, you have to wait so many days before you can send that animal to feedlot for slaughter. So some medication may have a longer withdrawal time than others, essentially.
So I know people when we go into shock after we've had like traumatic injury, this is pretty traumatic for our cow, and that we have an inflammatory response where our body kind of sends like its own version of painkiller, and cows have something like that, and would that affect what we're seeing on the charts? Because the controls were trauma, there was no control, or there was no trauma to the cow, and I don't know what it's like, because we saw a baseline on study 2 of what its cortisol levels were, but we didn't see like cortisol, because it's probably going to vary throughout the 56 days.
So you're asking if, sorry, repeat the question.
Sorry, that was a little long. If a cow like has trauma, their response to the inflammation, their own body produces something to kind of combat the inflammation at first. And if that's something that wasn't really looked at, in the controls, it looked like there wasn't much one that was just across the board, there was no trauma.
That's actually what like cortisol and serum hemoglobin is. So they're both produced as a response to stress. So these things are going to cause like more inflammation essentially. And whenever we're using meloxicam, we're trying to like combat those things to reduce the inflammation, so your body gets its healing faster, essentially. If that makes sense.
Do you have an understanding of why the FDA is prohibiting the use of these analgesics?
Well, you can still use it. It just has to be labeled extra level drug use. And I would say the reason it's not really been approved exactly is because agriculture, specifically this, hasn't been studied extensively. And also people are more, in the US, are more about money. So using analgesics is going to cost you more money. Whereas Canada, they call theirs the beef code of practice, and they're worried more about the animal itself, I guess, than the money.
Are they concerned about the change in the beef quality for the steer?
Using analgesics?
Yes, does that have any effect there?
Well, like I said, it does have a withdrawal time, so as long as you take it after that withdrawal time, it'll be fine. But then you still can't sell it and say it's like organic or it's all natural. So if you couldn't sell it to those markets, which could affect the money.